Coronavirus news. Omicron's BA.5 subvariant is dominating among COVID cases in the U.S. It's caused 78% of new infections across the U.S. just last week. That's up from 69% the week before, according to numbers from the U.S. Centers for Disease Control and Prevention. It's driving a wave of breakthrough infections and reinfections that has caused health officials to warn the public to pay attention to COVID levels in their communities. So let's get more perspective on the rise of the Omicron offshoot. BA.5 variant is Dr. Bill Hartman. He's with the UW Health System, or UW Health that is, and we appreciate you being here with us. So Dr. Hartman, let's begin. In just about 2 months now, BA.5 outcompeted its predecessors to become the dominant cause of COVID-19 in the United States. Is this growing variant a cause for concern, especially for people who are doing a lot of travel right now during the summer?
Well, it is a cause for concern. It's particularly slippery and evasive to the immunity that we've already had, whether we've had COVID-19 previously, including Omicron infection previously, or vaccinated. It seems to be able to get by that initial wave of antibodies, and it's causing reinfections really at a crazy pace. We don't even know exactly how many infections because so many people do home testing now that don't get reported. And so it's definitely taken over this entire country.
So what are you hearing or seeing about this variant with BA.5? How is it compared to some of the other ones? I think you touched on that a little bit, but is this a cause for increase in hospitalizations in Wisconsin?
We're seeing a small increase in hospitalizations. They're remaining relatively stable, but if it's anything like what has been observed with the BA.5 crisis in Europe, we're not seeing a huge increase in the number of ICU visits. And so the severity of disease seems to be pretty much under control right now. Hopefully it stays that way. And we don't see a large increase in hospitalizations and ICU visits.
Yeah, so that would be a good sign. It seems like we're continuing to circle back on the topic of getting vaccinated or boosted every time a new variant comes up. So how does the BA.5 subvariant stand up to vaccinations?
Well, it's particularly evasive to the initial immunity, and so that's why people are getting reinfections. But it's been very good at still preventing severe disease, hospitalization, and death. And really, the best way to prevent the bad things that can happen to you from COVID-19 is to get vaccinated and then to get boosted as well.
So when should you get boosted again? When would have been the last time? If you got boosted 6 months ago, 12 months ago, when do you need to get?
If you haven't had a booster or a shot this year, in 2022, it would be a good time to go get that booster now. Just sign up and go get your COVID-19 booster shot. It will not preclude you from getting another booster in the fall that may have Omicron mRNA in it, these so-called bivalent boosters. But really, to protect yourself and to protect your family and your community, get that booster right now.
All right, Dr. Bill Hartman with UW Health, we appreciate your time. Thanks for talking to us this afternoon.